Okay, good afternoon, everyone. We have a very interesting session this afternoon, and it is under the Unpause program that we have done. We are doing for the month of October, which we did as a campaign, which actually covers the topic of caregivers, the heroes among us. And this particular topic was mainly to focus on caregivers who manage and do caregiving for metastatic breast cancer patients. I would like to say thank you to Pfizer that has joined us for this campaign of Unpause for October 2021. And we're very proud to share this campaign with them and to focus on caregivers of mBC patients. Thank you to Pfizer. We're going to have a symposium of 3 different topics with regards to caregivers. And the first topic is today, and the topic is managing caregiver burnout. Many a time this topic is being ignored, and sometimes it is not focused upon by anyone. Everyone focuses on the patient, but hardly anybody focuses on the caregiver. So today we decided that these symposiums that we're going to have 3 symposiums, and all 3 symposiums will focus on caregivers. So we're very fortunate today. We have 2 very good guest speakers. The first of them is Associate Professor Dr. Seng Beng, who is a Palliative Care Physician from University Malaya Medical Center. And he is someone who is very famous. If you go to Amazon Books, you would actually be able to find his book on mindfulness. I think you've got another publication now.
Not yet.
Okay, so Mindfulness is a book that he has published, and you can actually buy it in Amazon. All right, and the other speaker we have is Chris Tan. Chris Tan is a caregiver for his wife, Khalees, who is an mBC patient. And Chris Tan also was viewed on social media in the month of October about his experience as a caregiver for his wife and his young family. And we have Khalees as well, Khalees Teo. Welcome as well to all 3 of you. But Khalees will be on standby if you all have any particular questions. But she has said, I'll leave it to you all. If you all can answer all the questions, she'll be happy about that. So we have an afternoon session today, and Prof. Tan will now set the scene about managing caregiver burnout. And then after that, we will have a Q&A, interactive discussion, and getting to know about managing caregiver burnout. So over to you, Prof. Tan.
Thank you, Ranjit. Today, I'm going to talk about managing caregiver burnout. I must say I'm not an expert in caregiver burnout. Ranjit probably knows more than me, and Chris. So later, if you have any question, you can ask Ranjit or Chris. I will try to answer if I know also. So I will start these slides with what is burnout. Burnout is a reaction to chronic stress. And when we experience stress, there are 3 stages of stress. First, we will experience a shock or alarm stage. Then we will experience the resistance stage. And after resisting for quite some time, then we may feel exhausted. And that is the stage of burnout, when exhaustion occurs. So when we burn out, we might develop mental health problem. And even though if we talk about burnout, in actual day-to-day life, when we experience burnout, our brain is very active and it's like burning, full of activities, full of thinking and thoughts. So what are the causes of burnout, caregiver burnout? The causes can be traced to the word care. If you are not involved in care, you will not experience caregiver burnout. So it's important to know what happens within the care. First, is about the senses. When we take care of a patient or our family member, we use our senses. And when we use our senses to perceive, there are a few things that we may experience, like, for example, seeing from the vision, seeing suffering of patients, seeing suffering of other family members, seeing suffering of other patients when we are in the hospital, or from hearing bad news, hearing expression of suffering from other patients. And the third senses are more of thinking. We are worrying about patients, worrying about other family members, or we perceive impending death of patients, or perceive impending absence of patients when patients are no longer doing certain things with us. Like, for example, when you're driving, then you used to drive together with patient, but now patient is hospitalized. So you perceive the absence of the patients or the impending absence of patient. That all these can give rise to suffering. And all these stress and suffering are related to perceptions. The second group of causes of caregiver burnout is related to our desires, our hope, our expectation. So in all our life, we have been running towards things that we like, chasing our desire, and running away from things that we don't like. So this may cause problems in caregiving. So these desires is related to our intentions, our want. So when we take care of a patient, if we want to give the best care, that one itself sometimes we can be obsessed, and it can give rise to stress or suffering. Or sometimes we want to keep a patient alive at all costs, despite the patient is getting worse day by day. So the one thing itself can give rise to a lot of suffering. And the third one is like you want to do something, is the compulsion to do something when you don't need to do anything. You just need to sit there and to give the patient your company, but you just cannot sit there and watch the patient getting worse. You just want to do something. That intention also give rise to stress and suffering. And when all of this you cannot achieve, then sometimes you feel hopeless, not knowing what to do, or helpless, not knowing what to say, or powerless, not knowing what to expect, or due to the lack of support. So all these are related to our intentions or desire. So these are the stress and suffering related to our intention. And the third group of stress and suffering is related to our action. When we take care of our family members who are sick, we will experience a burden. There are three main types of burden, like burden of companionship. You need to stay there 24 hours to give company for your loved one. Functional assistant, things that the patient cannot do, you have to assist them in doing it. It's like you are supporting all their function that they have lost. The third one is a financial assistance. And when you take care of a patient, you may experience many obstacles or challenges, either from the patient themselves, they don't want to listen to you, they have a difference in opinion, of other family members. Every family members have their own ideas how to take care of a patient, or what want the patients to try some medication, or even the healthcare worker, that they are too busy to give you the attention that you want. So all this may be an obstacles. And the caregiving itself can give rise to repercussion to your own personal life and also your social life. So these are the three main group of stressors that caregiver experience. And the three themes are derived from one of my research where I interview the caregivers of palliative care patients and analyze all their interviews and come out with all these stressors. So, and when you look at the three main group of caregiver stressors, they are related to perception, intention, and action. And if you compare it to compassion, which is often being defined as perception of another suffering, and the intention to relieve another suffering, coupled with the action to relieve another suffering. So it is almost similar. So we feel burnout when we care, and we feel burnout because we are compassionate. So that's why sometimes people use caregiver burnout or compassion fatigue to describe the exhaustion that they experience when they go through the caregiving task. So how to manage caregiver burnout? Today, I'm going to talk from the perspective of the caregiver, not from the perspective of help caregiver. So if we are the caregiver, how should we help ourselves? How to cool down our brain that are burning, like full of neurological activities, overthinking, excessively thinking, obsessed with a lot of things. How to make it like this, like cool down, very refreshing and very calm. So this short video will show one way is to, of course, pour water to the fire, to the brain, so it may calm down. But pouring water can be difficult, also can be dangerous sometimes. Yeah, like for instance, this for this particular example, when you pour water to cool down the brain, then the bucket can drop and hit you also. So maybe water from outside may not be useful. So from my previous research on suffering and stress of palliative care patients, I noticed that this E-square approach that can be useful. We have to ask ourselves, can you remove the events that cause you to stress? If you cannot remove the event, then can you transform the experiences? So you have to look at this E-square approach so that you don't just focus on the experience alone. If you are able to remove the event, then by all means, remove the events. But often in caregiving, the event is care. Unless you stop caring, you don't want to take care of your family member anymore, then you can remove the event. A lot of time, we cannot remove the event. So in that case, we have to transform our experience. And we can get some finding from this paper that I published. It is how to remain well despite caring for patients who are terminally ill. So how to remain well despite the negative experience that you may face when you take care of your family member. So from the paper, the well-being you can see the codes are the units of meaning that are derived from the interview that are transcribed. Then you can see there are a lot of negative experiences as well. But despite all these negative experience, there are many moments of well-being for this family caregiver. And these moments of well-being, they are characterized by 5 main themes. The first one is acceptance. They are able to accept their role as caregiver. They are not doing it like reluctantly. And they are able to accept the disease of the patient, and they are able to accept the imminent death of patient. And this acceptance are facilitated by the understanding the inevitability of death, by their own faith in their religion, and for certain caregiver, by seeing death as an ultimate relief for those patients who has been suffering intensively for a long time. So these are the facilitating factors for acceptance, and it is a dynamic process. Sometimes you accept, sometimes you cannot accept, and it is often characterized by living in the moment and able to move forward with life. The second important component of well-being for family caregiver is gratitude. They are able to feel grateful irrespective of how they are being treated in the hospital or how the difficult are their other family members, or they are able to feel grateful to God. And this gratitude is an important element. The third one is hope. They are hopeful. They hope for patient, and they have hope for themselves as well. And they are able to maintain a positive mindset. So hope is very important to remain well. And the fourth one, interestingly, despite they are given the job of caregiving, like taking care of their family member, some of them may be forced to do the caregiving, but they are able to feel happy because they are able to spend time with a patient. They are able to spend time also doing what they enjoy when they are not with the patient, and they know how to cope with the unhappiness. So happiness is possible despite taking care of someone at the end of life. And of course, there are 41 codes, not a lot, but 41 codes about support. Means this family caregiver, they are receiving support from other family members, from friends, from doctors and nurses, and from their own faith. So this one is external. The other all are elements within their mind, the resource within their mind. So if we want to remain well, we have to remember these few elements: acceptance, gratitude, hope, and happiness. And in terms of an event, try to mobilize support to help if you are too tired from the caregiving. So if I link together the themes of well-being with the themes of stress and suffering of family caregiver, when you see the suffering of patients, see the suffering of other family members, all this, if you are able to accept, or if you are able to cultivate acceptance again and again, whenever you feel not accepting, then you feel that you cultivate the acceptance again and again, then you may be able to reduce some of this caregiver stress. So the first match I do is acceptance, matching with the things that go through your senses, the perception. The second one, you may have a lot of desire or expectation or hope or wanting or craving. You want to give the best care. You want to keep patient alive at all costs. But if you find all these are giving rise to stress in you, you have to think of maybe switching your mind to feel grateful. To feel grateful, to be able to give the care to the patient rather than out of your expectation, the care. Or feel grateful to be able to accompany patient while they are still alive, rather than trying to focus on other things to like useless treatment that may even cause patient to suffer more. So if those desires are not fulfilled, then we may feel helpless, hopeless, or powerless. So we have to remain very hopeful. Every time we feel like powerless, we have to like have hope. Yeah. And the last one, actions. When we are taking care of a patient, we are helping to, like, for example, you are assisting a patient to eat, you are feeding the patient, you learn how to be happy in doing it. Or if you are changing the diapers of a patient, you learn how to be happy doing it, how to be completely in the moment, come back to the present moment and take care of a patient without thinking too much about other things, without thinking like, how come other family members, they are not helping me? I'm alone there. I'm so tired. So don't spend all this time like in this excessive thinking. See whether you can find some happiness when you are experiencing the caregiving. And if experience any obstacles, see whether you can like remain happy and see this as a mere differences in opinion, differences in perspective, and try to agree to disagree with other people. And in terms of the repercussion on the personal and social life, we can also mobilize support from our other family member, or even sometimes private nurse, or other friends, to see whether we can be relieved from the caregiving for a while, so that we can do something to recharge ourselves. So for the action, happiness and support can be useful. In a way, if burnout is because we care, and because of the intention, the perceptions, and the action, we can match the 5 themes of well-being with the respective the themes of the burnout. So I will introduce you a way to practice the well-being, is to, instead of pouring water to ourselves, we let the water rain inside our mind. Our mind is full of burning desires, burning suffering, burning thoughts. So we we let the rain pour down and cool down our mind. And this rain, I already repeat many times, it is an acronym of RAIN. So as every time you feel stressed when you're taking care of your loved one, you slow down, you take a deep breath, you center yourself, come back to the present moment. Instead of thinking about the past or future, you come back to the present moment and recognize your stressful experience. Acknowledge your stressful experience. And then, instead of resisting the stressful experience or the caregiving experience, you allow your thoughts and feelings to come and go. You allow them to arise, and you allow them to disappear naturally. You just don't sustain them. Once you recognize already, you're aware already, you allow, but you don't sustain them. And when your mind is clear, you try to investigate the causes of your stress with regards to the 3 themes that I mentioned just now: perceptions, intention, and action. Which one is causing me to stress? Is it because I witnesses the suffering of my family member? Or is it because I have excessive expectation of giving the best care? Or is it because I feel powerless when I do not know what to say to the patient? Or is it I'm burdened with the functional assistant? This patient is so heavy, I'm not able to turn the patient. So all this, you try to investigate the cause. If you want to manage something, you must investigate, know the cause, and then treat the cause specifically. And the last one will be to nurture yourself with the 5 themes that I mentioned. Nurture yourself with acceptance. Let the rain like cool you down with acceptance, and feel grateful, feel hopeful, and try to find some happiness in all these difficult moments, and try to get some support and accept the support from your other family member or friends. So the last one is nurture yourself. Sometimes it is also, the N also stands for non-reactive or non-identification. So you may have the perception, you may have the intention, but you do not react, you do not identify with them. You just watch them, observe them, allow them to come and go, and you nourish yourself with the rain of acceptance, gratitude, hope, happiness, and support. So I mean, you can advertisement a little bit. Now, of course, you can subscribe to my YouTube channel, Mindfulness in Palliative Care, and you can go through the mindfulness of rain to see how to practice this, so that every time you feel stressed when you're taking care of someone, then you can let it rain inside your mind. And after the rain, you are supposed to feel like very calm, and then cool down and very refreshing. So the caregiver experience can become like a very enjoyable. And this is what you usually call mindful caregiving. You're aware of what you're doing, and you're aware of the stress that arises, aware of the causes, and you allow them to come and go without like exacerbating them further. And to summarize, what is a mindful caregiving? It means, like, of course, a lot of people say, I eat to live, I live to eat. So they are like switching between these two. Some people eat to live, some people live to eat. But in mindfulness, you eat to eat. When you eat, you're not thinking about eating to live or living to eat. You are just eating to eat. When you wash the dish, you wash the dish to wash the dish. When you are taking care of a patient, you take care of a patient to take care of the patient, and not take care of patient to ... So that is the problem that give rise to all the perception, intention, and your actions that is in the caregiver stress that may lead to burnout. So remember, every time when you take care of someone, give 100% of your attention in taking care of the patient, and don't allow yourself to think excessively, and try to see whether you can feel happy in doing things that you do not like to do. And if you feel tired, then you should get some rest. You should know that you are tired, and see whether you can mobilize some support from other people. or support from your friends. So with that, that is the end of my presentation. Thank you so much.
Thank you, Prof. Tan, for very informative session. I would like to start with a question, but if anybody else has a question, you can put it in the chat box. I also would like to welcome Chris Tan, who is a caregiver, and we will now have some discussion and question and answer sessions. My question, first of all, to you, Prof. Tan, I actually wanted to bring up the issue of attachment. There is relationship usually with caregivers. The caregiver and the patient they are usually related. Either it is a husband or a parent or a child or a sibling. So there is a predisposed relationship between the two. To what extent does that relationship come in between that caregiving relationship issue?
Oh, yeah, I don't understand completely, but I try to answer it. There are majority of the caregivers, they are family members. Only a small proportion of caregiver, there are friends, or they are maybe they are church friends, or they are religious friend or volunteers. Very small proportion. Majority, they are family members, and you can see their relationship by looking at how they interact with each other, the dynamics of the family member. Each family, they have their own different dynamics. So what has been happening in the past that will affect how the caregiving as well. So if the past they are not in good terms with each other, and then now the caregiver come back to take care of the patient because of a blood relationship, then you may see the caregiving is a different experience. There may be a lot of a problem or issues or all these. So we have to explore their dynamics and also explore their openness to the help of other people, because some family, they are so close, their system, they don't allow other people to come in to take care of a patient as well. Even the community services like hospice. So we need to assess and see how they are. But I'm not sure whether I answer your question.
Yes, you did. You did answer my question. It is interesting because there is an issue of dynamics that I can see. If you are a health caregiver or if you're a family caregiver, there's a great deal of difference between the two. I guess a health caregiver has time for themselves and they are not involved personally into the whole thing, whereas a family caregiver is personally involved as well. So I would like to now switch to Chris. But Seng Beng, I want you to be around because there will be questions for you. Yeah. Chris, welcome to the session. Chris, would you like to explain a little bit about your experience and just introduce what you've been doing, and maybe then we can sort of have an interactive session.
Okay. Okay, just to introduce myself, my name is Chris. My wife is Kelly. She is the mBC patient. When we get to know, I think Prof session is really puts things in perspective for me. So I did experience all that burnout, not throughout the whole session of taking care of my wife, but during some parts. Of course, when we get to know that she was diagnosed, there was the initial feeling was denial. That's the first one, and the burnout at that point happened is that we continue to, we felt mentally very stressed and tired because we continually deny the fact that cancer happens to other people but not us. So we continually look for sources that it's not cancer. And when there's a part where finally it's the proof is solid, it sits in, we finally accepted it, there is a process of looking for a very long process of looking for the treatment, and there's also in as a caregiver as well. Primary caregiver for Kelly's. I'm also her husband, so we have 3 children. So it's not easy actually to balance between looking for treatment, looking for the right solution, and working and taking care of the children. So there's always to avoid burnout of myself and Kelly's. We also assigned other people's help, other family members help to help us with our daily routines, right? Fetching the kids, taking care of the children when we are not around or when we are in the hospital. And also lastly, the emotional part of the caregiver is very, very important. A lot of people say the caregiver has to be stronger than the patient, right? Sometimes the patients are stronger than the caregiver, because the caregiver will think, what happens when the patient is not around? When my wife is not around, I'll be left with 3 children. Things like that will happen in my mind, and but if the caregiver is emotionally more frail upfront than the patient, right? It doesn't help. It doesn't help. So I think for myself, mindfulness is one thing, but I think the support from my family members is very important to bring me through. Of course, every day I try to remind myself, don't look at the past, look at the future. The future is always bright. Look at the current situation, what we could do now. But everything is in the mind. So the caregiver needs someone to actually exchange the information, right? The other than the patient, there's also the third party, for us to actually interact, to let our grievances, to talk about what we really felt. That really helped to release the burden and the stress from me. So I talk a lot to my parents. I talk a lot even to my mother-in-law, even to my own kids. In some degree, they understand and they actually lift up my burden a lot. So otherwise, I think the burnout happens on and off when there's too many tasks, and you don't see the result. Like for example, we see a lot of doctors and we've done the treatment, but she's still feeling worse at times, and then work overwhelms you, and then your kids are not doing well at school, or and the nanny, everything comes in, and then you felt, oh, so tired. Why am I doing this? Why am I going through this? You blame yourself. What have I done wrong? But I think the most important thing for me is just I learned a lot about letting go. It's not easy to accept and let go. Means that you don't dwell on the past. And there's also one element of thing that is in the past, that we always have people that hurt us, right? People that we find it very hard to forgive. So that kind of feeling, unforgiving, sometimes during this time, right, we felt that probably that not in our heart, the unforgiving part of people that hurt us in the past makes us feel harder to give care, makes us harder, to go through this journey, and even part of that is probably causing the cancer, right? So the things that people hurt you past, that helps me and my wife as well going through this journey. So 1 year has passed, and then the scan is cleared for now. So and we continue to live positively, happily, and then we don't look at the back. We always look in the front. So that's very important. Sometimes burnout still happens to me, a lot of times, and Kelly's, in a way, also is my caregiver. I'm a caregiver. She's my caregiver as well, because she knows that if I fell, she will fail as well. Vice versa. Right. So yeah, this is my experience that I can share.
Thank you for sharing with us, Chris. I wanted to ask you, was there a time when you felt guilty about burnout, when you felt that I cannot take care of her and I'm going to call somebody else to take care of her? Did you feel guilty at any time about it?
Yeah, I always felt that's even at the point of time, I felt that I'm not in the right frame of mind to take care of my wife. So if there's a point of time where actually I thought of talking to a psychiatrist, because there's I kept thinking negative thoughts. I kept thinking, I shouldn't be in this position. Maybe I should be another person, that kind of, trying to escape from reality, So, I even asked my friends for, contact of psychiatrists. At that point, that is really, really bad. But, the key thing is, like I think what Prof mentioned is we still need to come back to reality. Even if you talk to a psychiatrist, things doesn't change, right? The things change our perception of, what's happening, right? How we respond. So the important thing is, about caregiver is don't be alone. Don't be alone. Try to reach out for a lot of people. Family is one thing. Friends could be another, because family sometimes they give you advice very emotionally. I don't know how to say this, but they link a lot of things to your past. Maybe some things in your past that you have done not correct, or you hurt them, or the patient even done some things in the past that doesn't, they will link it, and they will sometimes put the blame. Sometimes they not on the bad intention, but on the good intention, right? So if something comes to hurt you, but friends, not as close to you like family, the advice they give you, sometimes they just listen. They really help a lot, right? Kelly's friend, my wife's friend, my own friend, who's also has family members who have cancer, so they really understand, and then they different kind of inputs. Then you felt that, hey, I'm not alone here. So I'm not the only one who's trying to look for psychiatry. Somebody else did. So in a way, you lifted. You felt that, oh, I'm not alone. So I'm not. It's normal. It's normal to feel that way. If you felt that it's not normal, right, then you feel that I'm something wrong with me. So if you surround more people that are in the same wavelength, same experience, yeah, you will felt that you are stronger, right? So I think Kelly's and myself, we talk to a lot of mBC patients. We talk to a lot of caregivers who are mBC, caring for mBC. I think we gain strength from that. Sometimes we hear from them. A lot of people say, oh, you hear from them, you felt burdened. No, actually, we gain strength from that, knowing that they have the same experience. So you felt like comforted. So the key thing is talking to people, surrounding yourself with the people with the same experience, and keep yourself positive. And also, the religion came in a great part in this, because the religion gives you hope that there's something in the future. Because mBC patients, especially mBC patients, when you look at statistically, right, you're very worried. We are always very worried. Oh, 25%, 10%, live above 5 years. Ask the doctor. Is a wrong question to ask the doctor, but I did ask the doctor, and the doctor pulled me aside. It's 25%. Don't tell your wife. But then again, I said it to myself. But the doctor in the end said, your wife could be the 25%, and she could be the one that's going beyond 20 years, right? So we don't look at the statistics. I think the most importantly, we need to create our own path. That's the most important. So it's easier said than done. I'm still learning. A lot of times we look at the negative side of things, but we try to think positive. But we are still, I'm still learning. Kelly is also still learning. And thanks to you guys, hearing a lot from you guys, and also a lot of the mBC patients really helped us, and also people like Prof, right? They really share the theory behind it, and the experience really helped us a lot.
Yeah, Chris, I noticed that you look at the issue as a mutual support is what has helped you to feel that you're not alone, but you've got people around you who have a similar experience and who are going through a similar experience. And that gives you that additional feeling of wanting to carry on, wanting to move on with the same steam and the same amount of energy. So I wanted to ask Prof Tan here. Prof Tan, you heard a little bit about what Chris has gone through, the experience of him, his family, and his wife and his friends. And I mean, it is for him. It's for me looking at him. It's a huge task. He's got his job. He's got his children to look after. He's got his wife to look after. Then he's got to deal with family issues, which sometimes are wrapped up with a lot of emotional blackmail as well. And then he is looking for source of strength within himself and from outside. In the healthcare services, what do you have to offer someone like Chris?
Oh, okay. To answer your question, I think most of the time we need to know the needs of the family caregiver first. We have to explore and listen. Like for example, Chris just now, like he expressed all the experiences and the needs that, and we try to assess what are the needs, and then we as a healthcare giver in supporting the family member, there are two main things. One is we lend a listening ears. We listen to them and let them express so that the emotions that are not being expressed to the patient in front of the patient one, that can be expressed and ventilated. Then they can process all this. Once they process that in their mind, they may have more awareness and they may feel better. So that the first thing is like listening to them and assess their needs. The second way we can help is to provide them with accurate information. So this information, they may get it from the internet or whatever of various information, but they may get from other doctors also. But sometimes certain doctors, they are too busy to explain or too busy to put everything together in a very understandable way. So we provide them with medical information of the patient themselves and how to deal with them, and practical information of how to cope with their caregiving tasks. If they have a certain stress or certain emotional problem or any social problem, we see how we can provide them with useful information. Yeah. So mainly two things. One is explore and assess, listen to them. The second one is give them accurate information and connect them with the proper resources, such as BCWF and or other community service, or even my psychiatrist colleague. So if there are mental health requiring to see them, so it is a normal. It is normal to like go through all these emotional ups and downs, and sometimes if you let it you dwell on it longer, it may even lead to some mental health problem like what Chris has been going through. So it is our job is to recognize this and to like facilitate the connection with the proper resources to support them. Yeah, to connect them with the support that they need. Yeah.
Prof. Tan, I was just thinking of when children are distressed or when children have an issue, they tend to scream or yell or get rid of it. You know, as adults, we tend to lose that. We tend not to do that. Sometimes we shout at somebody rather than shout at ourselves. You know,
Doctors, shout at doctors.
we can't shout at doctors in Malaysia. You're always afraid that you'll be badly treated by the doctors, or they don't want to see you again. Uh, I wanted to, at this point, I wanted to bring Khalees into the picture, who is the patient and the wife of Chris. I don't know whether Khalees wants to join you or she's going to. Okay, Khalees, I wanted to ask you a question. Sometimes when we are patients and we're being cared for by somebody, and we find that that person is all the time with us, going through our suffering together with us, and going through more than our suffering sometimes because they tend to take on a lot of responsibility. Was there any point when you found that Chris was behaving differently and you felt guilty that you were responsible for it? Did you feel that way, and how did you manage that situation? You can unmute yourself to answer.
Okay, your question means that he behaved differently, is it? During
yeah, when you felt that he was getting burnt out, or he was getting really tired of this relationship of looking after you, and was there a point when you felt that I'm responsible for this?
Yes. Okay.
Talk about it.
I think there was once actually I asked him like, why is he behave so weird, and then that's where when he told me about his looking for psychiatrists, like what he mentioned just now. Okay, so I felt really guilty, yes. And then but how to overcome this, I actually encourage him to go for to look for someone to help. But somehow I think as things goes by, I think it gets better. I don't know, maybe he can continue later. And then but sometimes, like what Prof said, right, just now he said you must be hopeful for your situation. Yeah, sorry. And I think, how to say it, I think as a patient itself, because as Chris mentioned, I'm also a caregiver for him, because I do care for him, because he care for so many things else, like so many things else. So sometimes you are worried for him also. You're like, actually, whether he can take it or not, like whether he can manage or not, because they are like not only the cancer patients, he got his own how to say, he got his own responsibility, and also as a father, like what he mentioned, there's so many things. You have 3 kids, you have so many things to take care. Then you have your job to take care, because your wife is not working, like and also as a children himself, like mentioned about emotional, because sometimes from family members there are a lot of things that they care about you. They speak to you very direct, but actually unintentionally they actually bring up certain negative emotions or negative issues. So I also wonder whether he can take it or not, but I have seen that we have walked this far, and he has done a great job.
How old is your youngest child?
21 months. It's close to 2 years in February. Yeah. So I think I have mentioned, I have not really taken care of her actually, and she's like growing up so fast, So taking care of her is mainly by nanny and also by Chris. And for my first 2 sons, bathing them is like so easy. But for this, right, I think I have bathed for her for like 1 or 2 times until now. So the rest of it is actually taken care by Chris.
Yeah, I think you're really very sort of like close to each other, and I think that helps a great deal, because Prof Tan mentioned the word hope, and within the hope he also mentioned the fact that religion plays a very important role sometimes in our lives. Spirituality is very important. If you don't have religion, there's the other form of spirituality. So to what extent both of you actually drew your strength from spirituality or from religion?
I would say that we are Christian, so we actually have our church members to actually support us. So we have a group of them which is really they are really, how to say that, they are really concerned, and also they will every day, I think almost every day they will seek, like they will check on you, they will check on me, okay, and also sometimes some of them they will talk to Chris as well. So this one, how do we draw strength, right? I think first of all, from all these church members, all these church friends, and also from talking to them, and from whenever they ask me, right, I will tell them the actual feelings of mine. So I will not tell them that, oh, I'm very good or anything if I'm really not good. So I will tell them how I feel and everything. And also knowing them that they are praying for me every day. So this is something that comfort myself as well. And also, just now mentioned about the hopeful, right? So I think as a cancer patient itself, right, it's really important that we feel hopeful that how to say, we must feel hopeful that we are at the 25% lah, like what Chris mentioned. Okay, thanks to this, I didn't know that doctor pull him away and tell him this. Okay. Okay. Then so I think that the determination to live also is very important for the cancer patients, and do not always I know caregiver is really like, caregiver is very they will always feel stressed, but to Chris, he always, I think, tends not to show it in front of me. So I feel really hopeful whenever I told him, like, just an example, like tomorrow I'm going for my scan, so which is just happened like few days ago. So then I said, I worried lah, I still worried, although the previous scans are clear. So I always tell him that, how then he always tell me that, don't forget, you already have a clear scan, and we will confirm that you will get a clear scan again and again. So these things is coming out from his how to say, from his is like, it's very comforting. And sometimes you will wonder, what if the scan really not clear? So like, how are we going to move forward, right? But then he is always also very positive about this, like, whenever one day, or always 1 day or 2 days before, I feel that I myself also will be acting like very weird. I will feel like, how you 2 days, another 2 days is the scan, although I feel that I'm strong enough to actually go through it. And but how to say, the feeling of the how to say, the anxiety and the scared is still inside me. So I always tell him the same thing. I think I have been through a few scans for the past 1.5 years. So I always tell him the same thing, and he always quite very supportive, and he's also very hopeful lah. He's very positive about my condition. So yeah, so I think how we draw strength is not only from the church member, but also drawing strength from each other. Then we communicate more. I guess we communicate more throughout this journey, because we are still working from home and it's still MCO. Yeah.
Yeah. So the thing is, I noticed that it's you will trust his word, and you feel comfortable when he says, we'll see what can be done, and don't worry, your previous scan was good, and you feel comforted by that, so that you can go through another day in life without having too much of anxiety. Now the thing is, to what extent has the group Pink Inspirers helped you? Because you've got friends in there who have got a similar kind of situation, and they share a lot of information. Sometimes you get somebody saying that I want to punch somebody. Yeah. I want to do, they're sort of like at wit's end. To what extent do you find that kind of group being support for you?
Oh, I think for support group, it's really important. So like I just ask one questions, I can get a lot of answers from different people, and also they share their experiences. Just for example, I think I asked about my rashes. So they have so many informations from all of you, that I'm just like, wow, okay, one questions I can get so many answers, like everybody been through, and everybody been there, and they know. So that's why I think that all this support group is always very important. That's why I said I always mention I like to hear the sharing from the rest of the cancer patients, because it gives me strength as well. It gives me to be, sometimes you are more when they tell you that, okay, I have been there for 7 years, for example. So you are like, okay, although I'm just 1 year, so 7 years is there. So like you are more how to say, you are more hopeful that you can be there. She can be there, then you also can be there. So I think all these experiences helps. Okay, can we help us? And And yeah, all this helps, and also it encourage and motivate me. So I also that's why thanks to Pink's Inspirer, thanks to BCWA, so I have this opportunity to share out my experience as well. So so I think I gain strength from others people sharing. So I hope that my sharing also will give encouragements to the rest of the cancer patients, and also Chris and Prof sessions also will give encouragement to all the caregivers.
Okay, thank you for sharing, Carice. And Prof, what do you think of the source of sharing, the source of strength, the source of support that Chris and Carice are getting, and how they look for it as well?
I mean, listening to Kelly's journey and Chris' journey, looks like the family dynamics are very cohesive, like a very cohesive family dynamics. So usually this support, they are very healthy. Compared to certain other family members, they are not so supportive of each other, or they may even cause more problems. So I think it is always good to have a very cohesive family system. Then when you need to support each other, it is easy, because when you experience a disease, the caregiver can experience similar suffering, and there can be mutual, like what Chris just now explained. In the medical terms, we call it the reciprocal suffering. So it is always good to have a cohesive family system, so that they can support each other. Because some family system, they have this, they can be cohesive, they also got this cone of silence. The cones of silence can be medical, can be emotional. Medical means they try to hide the medical information from the patient, wanting to protect the patient. But that is not so healthy. And some, they want to hide their emotions. That means they don't want to cry in front of the patient, or the patient want to look strong in front of the caregiver. So these are not very healthy coping mechanism. The healthy one is you just express. If you have any negative thoughts or emotion, you have to express it and communicate within the family system, like what Kalis and Chris is doing, except the 25% part, but now already expressed. Yeah. So yeah, these are the communication things that are important, that you need to express it, but not to dwell on it for a long time. It means you can express it once, but you don't. Let's say you feel very sad. You express your sadness, and you have the negative thoughts. You're aware of it, but you don't sustain it or dwell on it and repeat it and recycle it again and again until it becomes a mental illness. So you need to know that all these negative thoughts and emotions and suffering, they are normal reactions towards all these events that are happening in our life. They are normal. They are not like abnormal. But we don't want to let it sustain for a long time. We don't want to dwell on it. If there's a negative thoughts, if there's a negative emotions like fear, anger, sadness, all these, they are normal reactions. We have to acknowledge them. We have to investigate the cause, and we have to deal with it, and not to sustain it, and so that it will affect us again and again and again. So of course, I support caregiver and patients to train their mind before they are sick, because an untrained mind, they will follow all the events that are happening to them. If they are unpleasant, they will go through all the stress and suffering one by one. If you have a trained mind, the moment you are aware of the negative thoughts or emotions, you can come out of it already. You got the awareness. You can come out and distance yourself from the train of negative thoughts and emotions. So if you have a trained mind, then it is easier But of course, the support from each other also can be very important because you see how other people cope. So yeah, to draw strength from different resources that very good. At the same time, don't neglect our own resources in our mind that can give us a lot of support even when we are alone. But that only happens if we have trained our mind. And untrained mind, they cannot. They will just break down when they experience any unpleasant event in life.
So, Prof, what do you mean by trained mind?
Or trained mind means you have your awareness, you have your attention. You have trained your attention so much that you can put your attention on certain thing. And let's say if you want to divert your attention away from the thoughts, you can divert easily. They won't like stick on and dwell on like sticky on the event. For example, I give a very easy example. Let's say a patient goes to the hospital, then experience a nurse. A nurse is very rude, scold the patient. So after that, you are hurt. After you're hurt, you feel bad, you feel angry. But after that, you're discharged home already. The nurse is no longer there to scold you, but you still keep the nurse in your mind to scold you again and again. You are not able to like forget and let go of the dwelling or the clinging on the experience. So the untrained mind will go back to the event and ruminate on the event again and again, or worry or whatever. But a trained mind, where you want to put, you can put. Like you want to come back to the present moment, you will come back to the present moment. You want to pay attention on something, then you can put your attention there because your muscles of the attention is very strong. Your muscles of letting go of the distraction or the dwelling on the negative thing is very strong. You have already trained in a gym for your mind. Yeah. So
that could be any emotion. It could be anger, it could be sadness, it could be anything, guilt, anything.
Any emotion. Once you're aware, if your mind is trained, you can walk out from it instantly. Then if you're untrained, then you'll be pulled back. So you can use it as an opportunity to train now. That means if you pull back to the train of thoughts again, you can come up again and again and again. Yeah.
So it's more like forgive and forget.
Yeah. Not so much about forget lah. You may not forget lah.
Yeah.
It's like more let go.
All right. So we have somebody who's got a question.
Okay, my question is actually pertaining to the final part that Prof. Tan was mentioning about the trained mind. That seemed quite interesting. I was just wondering, how does a caregiver or a patient in that matter train their minds to be yeah, I mean, sometimes it's easier for some people, sometimes it's not. So is there any suggestions on how it would be easier for them to be a trained, someone with that kind of a mindset? That's all.
Oh, okay. Yeah. How to train the mind? Yeah. Oh, that's my favorite topic. Yeah. I used to have multiple sessions for caregiver or for patients, guiding them how to like train their mind in particularly with the practice of mindfulness. But with the COVID-19 lockdown, everything, so I have stopped temporarily. Usually, it is advisable to start training the mind by practicing exercises like mindfulness of the body. And once the foundation is strong, then only move forwards to mindfulness of feelings, mindfulness of the mind and the thoughts. So when we practice mindfulness of the body, there are many objects that we can use as a object of attention to train our mind. Usually we use the breath. That means we pay attention to our breathing as we breathe in and out. That is mindfulness of the breath. And then expand our attention to our body posture, to be aware of our body posture and aware of our bodily activities. That means in our daily life, whatever we are doing, we pay attention completely to what we are doing instead of like multitasking. We come back to the present moment, unite our mind and our body using the breath as a bridge or an anchor, and pay attention to what we are doing completely. Like for example, when I'm listening to Ranjit speaking, then I pay 100% attention to Ranjit speaking. I'm not like judging what Ranjit is saying. I'm not like thinking about going somewhere, but this one I'm thinking about going somewhere lah. After this talk lah, yeah, thinking about going to play basketball soon. One is end. You got 3 more minutes. So, but yeah, that is how we train the mind. Start from mindfulness of the breath, mindfulness of the posture, and then mindfulness of the bodily activities. And there are many other exercises in mindfulness of the body, including mindfulness of the body parts, like a body scan. How do we scan our body? How do we relax our body, every single muscles? How do we relax them one by one? So that every time we feel a bit tense, we can be aware of the tenseness. Where is it? Is it the neck? Or is it the forehead? Or is it our chest? So we can relax this muscle voluntarily. So we become a master of relaxation after we practice for a long time. So that's mindfulness of the body. Then followed by the other more advanced exercise, how to be aware of our difficult emotions, how to be aware of how the emotions is influencing our thoughts, and how they are keeping our mind fixed on certain thing for a long time, so that we can release ourselves from all this clinging or the stickiness. Yeah, start from training the body, awareness of the body.
So this is something that you need to do repeatedly, so that it's like an exercise, which helps you to be aware. I have a brief sharing in the chat box. Yes, doctor, you are correct. I can forgive but cannot forget. I was a caregiver for my siblings and my dad. It was not hard to take care of them, but taking care of my husband was very difficult. So she's sharing a bit of her experience. I would like to thank all 3 speakers, Prof. Tan, Chris Tan, and Calistio, for having shared this very invaluable information with us. You gave us knowledge, you shared with us something about your own life experience, and I think that you have really been someone who has selflessly shared your personal life story, because not everybody shares their personal life story. And for those of us who are listening here and watching and viewing this session, be mindful that when you share your own personal life experience, you are helping other people. When you help other people, you feel so much better as well. So with this, I would like to just go around the table. Chris, would you like to say anything, last few words to our audience before we end the session?
Yeah, I gained something here. Instead of sharing, I gained something from Prof about mindfulness. So this is, and also training the mind. So I think this is something that I will practice more. Be mindfulness of the body and then of the emotions. But something I would like to share with the audience as well is that surround yourself with positive people. That's the most important. That really helps you to train your mind, because you train but people around you say negative all the time is a bit harder, right? Surround yourself with, you can choose and surround yourself with positive people. You can talk to more people within your same conditions to see that you're not alone, and then it gives you strength to also train your mind. And lastly, I think you need to find the strength from your heart and, to love the patient. That's the most important. If, in the end, if you don't love your patient, if you don't find the strength or the thing to do it for the patient, everything, that's how you train your mind, how you do all the things, it doesn't matter, right? So, who is the patient to you? Could be your mother, could be your friend, could be your wife, think about, what the person means to you, that gives you strength. That what is giving me strength, in a lot of times. Yeah.
Thank you, Chris. Khalees, do you want to say something to end the session?
Yeah, okay.
You need to unmute.
Yeah, sorry. Can you hear me now?
Yes, we can hear you.
Okay, I agreed with what Chris had mentioned about trained mind, which is what Prof already teach us. A lot of times, to be honest, my mind are not trained, Prof. So I think these sessions already teach me how to let go more, and also how to say forgive but not forget. No, but this is something that I have learned today, and also want to thanks Ranjit for these sessions. Thanks Prof, and also to all the cancer patients, and also cancer patients out there. Please always feel how to say, feel positive and feel hopeful that, and determined that you can live further than this, and to let go of all the negative emotions. Sometimes I think I myself also very hard to do this, but after today I think I have to train it more. Okay, and to all the caregivers, uh, to always, how to say it, sometimes you don't how to say, you don't how to say, don't push the patient too much, and do not limit their how to say, do not limit their preference, or limit their, for example, a very simple thing that I always want to share is their diet. Do not always give them stress about the diet. Thankfully, Chris never do that to me, because I'm very happy about that. So but I have seen many patients that actually comes to me talk about the diet as well lah. So as a caregiver, just be supportive, and of course, not to say you allow them to eat all the unhealthy food, but just don't always tell them that this can't eat, the one can't eat, because going through the journey itself is already very stressed, and don't add on the stress to yourself and to the cancer patients. Yeah, this is what I want to say.
Yeah,
Thank you.
Thank you very much, Khalees. Once in a while, it's good to eat ice cream or chocolates. Prof.
Yeah.
Tan,
Yes.
Prof. Tan, you have the last word during this session.
I resonate with Khalees. Yeah, when you are going through the disease, you are the only person who know the experience. Other people may try to understand from you, but the actual direct experiencing is you. So it is always good to let the patient, my magic sentence is let the patient be the lead in terms of what to eat, what when to eat, and what amount to eat, and not force them to eat, because a lot of time we see, but this one is more applied to the patient who are more sick. When they are very sick, they are not eating anything at all, the family will force them to eat, and they seems to believe that by forcing them, they may not get dinner so fast, or the disease may not get worse, or they may not starve, or all this. But a lot of time, it's making the situation worse. So in terms of feeding and eating, always let the patient be the lead. Yeah.
Thank you very much. Okay, and so we conclude today's session, which is managing caregiver burnout. And I hope everybody has benefited from this session. I wish to thank all three speakers for making this a very enriching experience for all of us. So have a good day, and thank you very much to everyone.
Thank you, Ranjit. Thank you.
Let's give them a big hand.